Dietitians can help promote health and prevent disease through nutrition education and behavior counseling. In this video, you will learn what a dietitian is, what work dietitians do, and how to find a dietitian. A dietitian is a healthcare professional with special training in food and nutrition for human health. They use medical nutrition therapy to treat many different health conditions, like obesity, kidney disease, or diabetes, to name a few. Medical nutrition therapy is based on scientific research and allows dietitians to assess and diagnose a patient's nutrition problems. Dietitians then work with the patient to determine an appropriate plan of intervention to help solve the nutrition problem. Over time, the dietitian can monitor and evaluate how well the intervention is working for the patient and make changes with the patient, as they are needed. Dietitians are required to take many of the same foundational science classes as nurses, such as anatomy and physiology, psychology, microbiology, biology, chemistry, and organic chemistry. Currently, a bachelor's degree is required, but at the beginning of 2024, a master's degree will be required for those who want to become dietitians. Once completing the required college coursework for dietetics, students must apply for and complete an intensive internship, usually anywhere from 8 to 12 months long at a full-time commitment, to gain experience in the field. Then they must pass a national exam to become a registered dietitian. Then they must complete 75 continuing education credits over every 5 years they are a registered dietitian. In addition, almost every state in the United States requires the registered dietitian to be licensed in the state they work in, and maintaining this license also requires completing continuing education credits. Dietitians can work in many different places, but most work in clinical settings such as hospitals. Dietitians can also work in nursing homes, schools, for sports teams, in private practice, in the food industry, research and education, community nonprofits like food banks, corporate wellness, retail, like giant grocery stores, and government programs like WIC and SNAP and others. Like many healthcare professionals, dietitians can choose to specialize in different areas, such as pediatrics, sports nutrition, gut health, diabetes, eating disorders, and renal nutrition, to name a few. Depending on where dietitians work, they may be helping sick people to improve their health through nutrition or healthy people to optimize their nutrition and stay healthy. In this way, dietitians can help to prevent and treat many diseases that are influenced by what we eat and how much we eat. As you can see, dietitians can do many types of work depending on the population they work with. A clinical dietitian working in a hospital could be calculating energy needs for a patient that requires tube feeding, or if they worked in the NICU, helping to feed and keep alive babies who are born prematurely. A dietitian working at a dialysis clinic would counsel patients on how to change their diet to prevent certain minerals in their blood from being dangerously high. A dietitian working in a nursing home would work with the medical team to provide adequate nutrition for those residents who are at risk of malnutrition. Dietitians in private practice could be providing nutrition counseling to help people lose weight, improve blood pressure and blood sugar, decrease GI problems, or fight eating disorders. If you are looking for an outpatient dietitian, you can easily find many online. Or you can ask your doctor about making a referral for you to see a dietitian in your area. Try to find one that specializes in your health concern or goal. Some websites where you can find a dietitian include HealthProfs, ZocDoc, Nutritionist Near Me, and the Academy of Nutrition and Dietetics Eat Right website.